Now, cases including operations on the wrong part of the body, foreign objects left behind after surgery, and death. That's what BBC Radio Kent investigation has discovered, that there were nearly 400 serious incidents in the county's hospitals in a year. But the NHS says the vast majority of patients receive harm-free care. Nick Fairweather's a medical negligence lawyer, and he's on the line now. Morning, Nick. The NHS is right, isn't it? The vast majority of people get great care from the NHS.
Yes, absolutely, John, and I think these figures do need to be put in context. The NHS, in all its guises, treats more than 1 million people a day, and so one can understand that things do go wrong. What we need is a transparent and adequate reporting system.
Have we got that?
It's very difficult to say. I mean, I think we maybe are making some steps in the right direction here. It's very difficult, you know. In a way, a conscientious NHS trust that's very honest and transparent, and when things go wrong, they are alerted to it and report it and notify patients and operate the new duty of candour and everything else. Maybe a trust that produces slightly higher figures than another trust that isn't quite so forthcoming. So it's a difficult thing, and it's difficult to read these statistics and have very sort of precise lessons from them.
In a way, are people like yourselves in a way to blame, in the sense that I'm just wondering whether hospitals are a bit nervous about admitting wrongdoing because they're obviously, you know, scared of being sued?
Well, I think the situation that I've seen, having dealt with cases, medical negligence cases in Kent for many years, what actually pushes legal costs up, and not just legal costs up, but the misery and frustration of families, is when NHS trusts try and cover up when things have gone wrong, when they're not forthcoming and they're not admitting things and they're not making apologies. And most of all, and what most of my patients want to see, most of all, is that lessons are really, truly learned.
Well, I was going to ask you about that. I'm wondering, in the sort of cases that you handle, do you ever go back to the hospital and see what has changed so that can't happen again?
Yes, we do. I mean, for example, I was at a mediation before Christmas in a very serious mental health case where we actually sat down with the clinical director of the Mental Health Trust in Kent and went through a whole range of changes that had happened on the back of this particular case. Now, that family had waited a number of years for that to happen, but I can't tell you how pleased they were with that constructive dialogue and to actually understand that lessons had been learned and that hopefully another family wouldn't go through what they have in the future. And I had to say, that's what the vast majority of my clients, that's their attitude. You know, of course they can be embittered and they're saddened and upset when they've lost loved ones or they've been seriously injured, but they really want lessons to be genuinely learned. And I think there's a great consensus now, John, across the NHS and across government as to the need for transparency and openness and for lessons to be learned.
I wonder, I mean, some of the examples that we've got, I mean, to be honest, out of the 400 incidents, 6 of them are what they call never incidents. They should never happen. And they include things like operating on the wrong limb, for instance. I mean, which I don't quite understand how that could happen.
Well, I think that's very interesting. There are 14 categories of never incidents that operate, and as the name suggests, these are things in a health setting that absolutely shouldn't occur. And so, the discrete reporting of such incidents on a national basis, I think, is very important. As you say, there's 4 or 6, I think, of these incidents throughout Kent. Now, look, they are reporting; they should never happen, but that is a very, very small number. And of course, if they are reported and reported openly, then procedure can be put in place on top of what's already there to try and make sure that really truly ridiculous things like that don't occur or occur to the very, very minimal extent.
Nick, thank you very much indeed. That's Nick Fairweather, a Kent-based solicitor specialising in medical negligence. We did request interviews from all 4 of our trusts, but they declined. They all sent us statements, each of which outlines that they thoroughly investigate serious incidents to make sure that they don't